That's very interesting, Dr. Priya.
Thank you.
Yeah. We would also like to know what is the vision of Prakriti Laya that you would like to share with the people.
Well, Prakriti Laya is a place for support seekers. I rather call everybody support seekers because, calling mental health sufferers a patient, I don't like it because it is not true. This is not for mental health patients. This is basically for mental health support seekers. Why, I will explain. Because I cannot handle if somebody is having some major psychiatric issues here, because with the therapeutic sessions without medication, that would be a bad gesture for the people. So we are working and on hand by hand with other psychiatrists and other doctors who are like first handling the patients and sending them to us. Why I'm calling it support seekers, basically, 90% people have mental health issues. The mental health concerns issues were not that people doesn't take it seriously. They're fearful, they can get judged, and they feel, okay, if I'm going to a doctor or to someone, to a counselor, they can get judged. So, so many years I have been seeing that through my friends, colleagues and family members. I've seen that. So when I finished my mental health research, when I started my company, there was one vision that, okay, people should not be uncomfortable when they're coming to me. They should not be stressed out, serious, not at all. When you are coming to Prakriti Laya, the 7 colors of happiness, if you yourself not feeling the 7 colors of happiness, then how you can transform your entire life? And yeah, everybody has problem, everybody, like 90% people, that is documented in psychiatry. Someone has fear, even I had fear, flight phobia, and many people has many issues. But when it comes as a concern, they feel it difficult to live with, but they don't come to anyone. Nowadays, through hypnotherapy, NLP, counseling, CBTs, DBTs, and other all the mental health methodologies, people are actually concerned. And that too, yeah, I'm practicing this is in a developing, it's a developed country, the first world. So people are of course concerned. So what I have noticed, like especially my support seekers, they're in good post, they're working nice, and they're all, everything is normal in their life. When they're very fearful, people can just judge them when because they're visiting to a doctor. So you can ask support. Obviously, you can seek support from someone, from your friend, from your family, and we professionals sitting here to support you. So obviously, you are a support seeker. And my entire vision is about Prakriti Laya. Okay, I'm not working for free in Prakriti Laya, right? I'm getting my professional charges. And when a support seeker is coming and paying a professional charge, sometimes it becomes, that product exchanging kind of thing. Okay, I paid to the doctor, I got my treatment kind of stuff. So I did not want that, I wanted that my support seekers should love me. They should understand me, what I'm doing. They should understand that actually it's just not, I'm just taking a money. It's a value, it's not an exchange of something. It is something to run a company, to run my profession, it's just a professional fees. That does not mean I don't love my Prakriti Layans. And they say, no doctor should love their patient. But in my case, this is entirely a wrong thing. Being a holistic practitioner, being a hypnotherapist, being an NLP practitioner, I feel, being a mental health practitioner, you need to love your patients, you need to love your support seekers. Without love, how can you treat someone? How can you give therapeutic sessions to someone? That is absolutely impossible. And you know what? People who are coming, obviously they're not getting treated by free. They still love me because the time, the love I'm giving them. It's all about the non-verbal communications towards. So yeah, this was my vision, and I just wanted to do Prakriti Laya in a style, in elegance, in that's mental health fashion, I would rather say. It's not necessary to be a mental health professional. You have to be serious. You have to just look like a geek. It's not necessary. Who set these standards? For whom? And who are these people? You cannot judge anyone. You cannot judge my talent just by my looks. Even I cannot judge anyone by their looks. So, yeah, I myself, I am a colorful person. So what I wanted, if a patient or a support seeker is coming to me, they should feel the color of Prakriti Laya. They should feel the fashion of mental health. They should not feel ashamed of themselves. They should feel happy. Yes, I am a Prakriti Laya. And yes, I have been there. They're transforming their entire life, entire self. And what I tell them in a counseling sessions, in a CBTs or everything, like all the methodologies I use, I feel that, I know that is true because I tell from my life what I do from my side. So it's not that they are just my support seekers. They're the entire family. The Prakriti Laya defines Prakriti Layans, and without Prakriti Layans, I am just no one.